Further debate, I recognize the member from Ottawa South.
Thank you very much, Speaker. And before I get right into Bill 175, I'd like to say something about the current state of affairs here in Ontario. So first of all, I think we owe thanks to all Ontarians, especially those working on the front lines, for their efforts and their sacrifices at this time. Together, we've helped to manage the spread of COVID-19, and in turn, it's given us time to learn how to better manage the risks that are related to COVID-19. We know that hand washing, physical distancing, and wearing a mask when you're in stores or public places where physical distancing isn't possible are the most effective ways of reducing the spread and keeping each other safe. Some say it's as safe as a vaccine. So we also know that we can and we will get through this together. We just need to keep working together and keep looking out for each other. Our success so far has been based in community, and that's something that Bill 75 lacks. Similar to the Connect and Care Act and its super agency, the bill is taking governance and decision-making out of communities and parking it here in downtown Toronto. That's not good for communities. It's not good for home care. I am deeply concerned that we're taking the community out of care. We should not be in third reading on this bill. It should be withdrawn. The majority of presenters at committee made the same request. There was a similar refrain. Why are you doing this now, in the middle of a pandemic? Providers are still reeling from the loss of staff, the lack of PPE, and clear health and safety protocols. It became obvious that community care was at the bottom of the checklist when it came to our response to the pandemic. Home care was forgotten when it came to pandemic planning. Effectively an afterthought. Bill 175 is going to do nothing right now to help those providing care or those receiving it. So why are we doing it? We should be focusing on helping home care providers and their clients in adapting to the new realities COVID-19 has created or exposed. We're doing the wrong thing at the wrong time. It should be withdrawn. Full stop. Bill 175 removes critical protective measures enshrined in legislation and moves them into regulation. It allows this government and future governments to more easily alter important protections with little oversight, sector consideration, or legislative approval. That's what we're here for. We're not here for regulation, we're here for legislation, so we can debate things fully, so the people have a say. That's the difference between legislation and regulation. In here, they really have a say. Here's what should be in the legislation. Bill 175 should include the Patient Bill of Rights. This government is attempting to move the Patient Bill of Rights, outlining patients' right to care, from legislation to regulation. This allows the government to change or omit this piece without having to go through a vote in the legislature. That Bill of Rights has been in that legislation for 25 years, and has helped thousands and thousands of people who weren't getting the care that they need and had to turn to legislation to get a satisfactory response to their rights in the situation. That's why you don't put it in regulation. It needs permanence. And the government did nothing to look at that to say, how can we change that right now? Or how could we update that? It's just, we'll figure it out later. Bill 175 should include abuse provisions. This measure would ensure that agencies funded by Ontario Health must have an anti-abuse plan to prevent and recognize and address physical, mental, or financial abuse of patients. Bill 175 should include an appeal process. That would ensure that there's a clear appeal process for patients and their families to follow in the event that concerns over the care delivery or delivery of services are not adequately addressed. There's currently one in that legislation. Why is there not that in this piece of legislation? Bill 175 should ensure accountability and transparency. Ontario Health teams and Ontario Health should be mandated by legislation to hold public engagements with sector partners and open board meetings. Now, Ontario Health essentially really doesn't have to report publicly. They don't have public board meetings. The minister, through Ontario Health, or with Ontario Health through the minister, can amalgamate, end a service in anybody's community in 30 days without notice, no right of appeal. That's in the Connecting Care Act. You haven't done anything to fix that. Still the same. Still the same. Challenge with that is, one day, 10 years from now, maybe in Brockville, Ontario Health's going to decide, you know, the Brockville General Hospital, they really shouldn't be on their own. And they shouldn't be doing obstetrics or orthopedics, or, you know, maybe they don't need diagnostics, or very fewer diagnostics. So you know what? 30 days, we're changing this. What's that community going to do? I got no appeal process. The same thing is happening to individuals in this bill by not having it there. It leaves people unprotected, like the Connecting Care Act leaves communities unprotected. And one day people are going to realize that, unless it's changed. Ce projet de loi devrait être retiré. L'Ontario est en train de faire face à la pandémie mondiale. Le gouvernement Ford ne devrait pas se précipiter à travers une législation qui a rédigé avant le virus pendant que le secteur se concentre sur la réponse à COVID-19. COVID-19 a changé la base de soins de santé dans cette province. Elle a révélé des vulnérabilités dans les systèmes qui doivent être prises en compte si nous voulons continuer avec une nouvelle approche de la prestation des services de soins dans la communauté. Le gouvernement devrait attendre à la fin de la pandémie pour revoir ces projets de loi afin que le secteur puisse être correctement consulté et que les principaux enseignements de la pandémie puissent être intégrés dans la législation. De plus, le gouvernement a l'intention de supprimer les mesures de protection essentielles inscrites dans la législation et de les déplacer vers la réglementation. Cela permet au gouvernement de modifier plus facilement d'importantes protections avec peu de surveillance, de considérations sectorielles ou d'approbation législative. C'est nécessaire pour inclure la déclaration des droits des patients dans la législation. Le gouvernement tente de faire passer à la Charte des droits des patients d'écrire des droits patients aux soins de la législation à la réglementation. Cela permet au gouvernement de modifier ou d'omettre cette pièce sans avoir à passer par un vote à la législature. Inclure des dispositions sur la violence dans les organismes financés par Santé Ontario doivent avoir un plan anti-violence pour prévenir, reconnaître et traiter la violence physique, mentale ou financière des patients. Inclure un processus de recours dans la législation. S'assurer qu'il existe un processus de recours clair à suivre pour les patients et leurs familles dans le cas où les soins ou les prestations des services ne sont pas traités de manière adéquate. Assurer la responsabilisation et la transparence. Les équipes de santé de l'Ontario et Santé Ontario seraient mandatées par la loi pour tenir des engagements publics avec des partenaires de secteur et des réunions ouvertes du conseil d'administration. So instead of debating this bill right now and passing this piece of legislation, which is not the right thing to do right now, what we should be doing is we should be looking at the Patient Bill of Rights, because there's not one in the Connect and Care Act. It doesn't exist. We're taking one of a piece of legislation, we're going to put it into regulation. What if the federal government decided to take the Charter of Rights and let's put that into legislation, or regulation, I should say? Well, they wouldn't. And they wouldn't because it's a foundational document. Bills of rights are foundational things when we're building legislation. It's what you build regulation off of. It's not what you put into regulation. You're putting it into regulation because you're in a hurry. You're in a hurry to do something that we don't need to do right now, that we shouldn't be doing right now. So you're taking the easy route. It's not the best route. So, both my colleagues in the NDP and ourselves put forward the existing bill of, the NDP put forward the existing Bill of Rights that exists in legislation with some changes. We put forward the same thing with a few more changes, a few additional things. And this was, and one of the things that we put in was the subject of debate and question period today. And I'll read you this point number 12 in the amendment that was put forward, the motion that was put forward. A person receiving a health service has the right to designate another person as their essential caregiver, to have access to that essential caregiver in any health care setting at any time, and to have that essential caregiver treated with respect as a valuable contributor to the care team. So we see this happening in long-term care, and we see it happening in hospitals. I know the member from London, Fanshawe? West? Fanshawe, I got it right the first time. I was talking about that today. This pandemic has helped us to see things clearly, the kind of things that the member from London Fanshawe was talking about this morning. They happened in hospitals before this. People have a right to their essential caregiver. And we've seen in long-term care, and that's why there's this debate right now where people can't get in. They're not just visitors, they're essential caregivers. They're part of a care team. They keep their loved one healthy. So we have to ask ourselves the question, and it's a bit off track, but in this situation, is isolation a drop in care? Are we doing more harm by keeping people out than COVID-19 is going to do? Like, we have to ask that question. And we can hear, even in the reports from the Canadian military, that the results of isolation and neglect kill people. It happened. Without a connection, we wither. And there's a real risk that we're doing more harm in this situation than good for many people. It's not easy, but we need to figure it out. And I heard my colleague from Nickel Belt talking about PSWs and this bill. This bill does nothing for PSWs. Does nothing to fix home care as far as PSWs go. We know what the problem is, and it's all of our problem. I'm not wagging my finger at you that it's your fault or my fault or their fault. I think it's all of our fault. There are people out there who are doing the heavy lifting. Right? What they need is, as my colleague from Nickel Belt said, is a stable job, decent pay. You need to be able to raise a family. That's going to make home care better. It's going to make it more stable. It's going to provide better care. It's not in here. And when the changes in labor legislation were undone to lower the minimum wage, require sick notes, eliminate 2 sick days, who do you think got hit the hardest? Or equal pay for equal work? Like, this act is an enabling act that just puts a bunch of stuff into regulation. It doesn't do anything to improve care. It's an enabling act. So let's not pretend that it's anything else but. We shouldn't be debating this bill right now. The government should withdraw this bill, get the lessons from COVID-19. We're going to change the way we look at home care. You know, I'll give you an example. My mom's at home right now, and she had a stroke 2 years ago. Many of you know that, and we're really lucky. Not everybody can do this, but we're able to help her stay at home. We get some help. We have some PSWs coming. One PSW that comes, it's a great PSW, and we really depend on her. But in my head, I'm thinking, do I want my mom in a congregate care setting? Right? Is it better for my mom to stay at home? Is it better for the extra effort from the families or the extra money that it's going to cost? Is there some way we can figure out not to do that? Not that they're bad, but it makes you rethink everything when we look at what's happening. And that's not just us, that's everybody else out there. I don't know how many people, when I say, you know, my mom's, we've been lucky, we've been able to keep my mom at home, they go, wow, that's really great. Now, before that, it was like, wow, that must be really tough. That's the first thing they say, right? That must be really hard, because it is. And it's, you know, it's not everybody has the opportunity, so we're lucky. But that's the change in the response. The response was like, my God, why? Like, I don't want to say, why are you doing that? But it's almost at that. That was the first. That's what they used to say. Like, wow, that's really hard. Like, not quite like implying like, why are you doing that? Now it's like, that was the right thing to do. And that's the way people are going to look at this. This bill won't fix that. We need to think more about what home care is going to look like. We need to do more to protect patient rights. Putting the Patient Bill of Rights into regulation, it's just the easy way out. And it's wrong because it's foundational. That's what you should be basing your regulations on. You know, not ensuring that there's an appeal process in legislation. Same problem. This piece of legislation has been around for 25 years, and it's served people well. It's not perfect. It's protected them when they needed it. It's given them a framework to say, I need to be treated fairly, and I'm not. And I've got a process by which I can contest that. I have certain rights. I deserve to be treated a certain way. Should have been updated to take a look at essential caregivers. So I'll tell you an important story about why caregivers are important. When I was young, my dad's mother was in St. Vincent's Hospital. I'll try to abbreviate this story. Chronic care hospital. She suffered from depression through most of her life. She had 2 broken hips. And when she finally ended up there, they said to my dad, your mother has Jacobs-Creutzfeldt disease, mad cow disease, right? She's got premature senility. She's going to die in 6 months. So she actually was there for about 6 years. My dad used to visit her every day. And he kept trying to figure out what was going on, like questioning the doctors or whatever. And then he finally bought the compendium of pharmaceuticals and looked up all her drugs. And he was smart, not a doctor, but he was smart and figured it out and went to his doctor friend and said, I think this is what's happening with my mom's drug list. I think it's affecting her the wrong way. It's creating her condition. Anyways, his doctor friend said, as we all had to be deferential to physicians, and still are in a lot of ways, but more so 30 years ago, you can't do that. You're not allowed to do that. You're not a doctor, right? My dad said, well, could I be right? Dr. Premier said, well, you could be right. So he went to see the resident, okay, and said, I think there's this problem. The resident, who was the attending resident, took her off the drug. Remember, she was there 6 years, kind of in and out, with different people coming beside her in that semi-private room for 6 years. Changed the drug. She got out of hospital, lived 6 years semi-independently. That's why essential caregivers are important. That's why we have to listen to patients and their families. Thank you very much, Speaker.